as you know, it may start off by swallowing a pill, and they experiment, and they're smoking it, or snorting it, and then they'll go to direct intravenous injection. And the complications that can occur from this are innumerable. Just from having dirty needles and sharing them, patients, people can get hepatitis B, hepatitis C, HIV. Those are the most significant, but any other blood infections can occur. I've seen over the course of my career over and over people who've injected, and in the injected itself, many times whether it's cocaine, whether it's these pills, or cut with talc, or any other number of things, none of which belong in the body, and they can form clots. Once injected, they can get plugged up into the lung. They can cause an allergic or inflammatory response by the lung itself. Once it's injected into the vein, it travels right into the lungs. Bacteria that can be injected can grow on the right side of the heart, causing endocarditis, which may cause, the person may need 3 to 6 weeks of IV antibiotics. They may need to have open heart surgery to have the valve replaced. The infections can spread into the lungs, causing septic emboli throughout the lungs. The lung can have an inflammatory response to the presence of the talc or whatever else the drug is cut with, and they can get something called acute respiratory distress syndrome, ARDS, where they have very low oxygen levels. They may need to be on mechanical ventilation for several days. The mortality of that is extremely high, up to 40–50% alone. I mentioned endocarditis, the infection on the heart, and the prolonged need for antibiotics. The infection can spread from the heart to anywhere in the body. The infection cause abscesses in the brain, in the extremities, in the intestines, and the lungs itself, into the bone, causing osteomyelitis. There can be cellulitis from where they've injected, infection, inflammation to the skin. They can have abscesses in their skin. Can cause inflammation to the veins themselves, phlebitis. That could be a chronic problem. People have lost limbs. People have ended up losing their brain ability from abscesses in the lungs and the destruction it's caused. They may end up short of breath for forever if the lungs had a severe response to what they've injected. Depending on what happens with their heart, they may have heart disease. These are very advanced disease processes which are very serious and have high mortalities, which are occurring often in a population of younger people who are going to have to suffer the consequence of this for decades to come. From a socioeconomic perspective, not only are we dealing with younger people with a decreased ability to work and lead meaningful, productive lives, many times they're uninsured. And so the financial burden of caring for them falls on all of us as taxpayers. And it's very disheartening to treat, especially when a person is truly addicted. You can discharge them from the hospital on IV antibiotics, and they'll just come right back a couple months later with the same infection. It brings up, further from financial perspectives, it brings up ethical questions in that if I had an infection in my heart or in my lungs or my bone that might need 3 to 6 weeks of intravenous antibiotics, I could be discharged from the hospital with an IV line, and I would take my medication at home with the help of home health care, etc. However, you don't want to discharge a street addict with an indwelling IV line who's going to go back out, shoot right up, now that he has a main line that he can freely use. So what do you do with a patient like that? You have to keep them in the hospital for 3 to 6 weeks so that they don't go out and use a PICC line to shoot up again. The costs can be run into the hundreds of thousands of dollars on this. They're easy to spot because from the moment they walk in the door until the moment they leave, they continually redirect the conversation back towards their desire or their need for opiates, with a story that almost is virtually universal of how many people they've been to, how many accidents have occurred, so-and-so, I was on this, and then so-and-so did this, and then I couldn't get it here, and now so-and-so won't help me. And they create this picture where it's somehow my responsibility to help them with their narcotic need rather than what they're coming in for, let's say for a breathing issue. And I may explain, look, I'm here. You're here as a pulmonology patient. You're here for your lungs. You're here for a cough. But they continue to redirect it back towards their need for opiates or for benzodiazepines over and over and over. And most addicts universally act like that, and most physicians can sniff them out easily because they all act the same way.